And joining us now is epidemiologist and the dean of Harvard School of Public Health, Dr. Michelle Williams. Thanks so much for being with us this afternoon.
Thank you.
And I just want to pick up on Mary Alice's report there, the crisis in India now coming into the diplomatic circles, at the Indian G7 delegation pulling out of face-to-face meetings there after, possible exposure to coronavirus. And this comes as the disease just continues to ravage India. Meanwhile, 56% of the U.S. adult population has received at least one dose of the vaccination. What does that tell us? What should we make of the incredible stark disparities across the world of how countries are advancing through this pandemic?
You know, the incident at the G7 reminds us that this is a global issue, that we have to collectively work together to break the spread of this pandemic. I also think that the G7 summit circumstances reminds us that we still have to use all of the public health procedures to diminish the risk of transmission as we try to get the globe up vaccinated. Vaccine diplomacy, I think this is a perfect example, watching what's unfolding at the G7, and we need to really push the envelope on getting more jabs into the arms of people around the globe, the U.S. and globally.
And Dr. Williams, here in the U.S., President Biden yesterday announced this new goal of getting 70% of U.S. adults at least partially vaccinated by July 4th. One, how doable do you think that is, and how much would it impact how quickly we can resume normal activities?
First of all, it is a bold decision to make to get, something like 160 million people vaccinated by July 4th. But we need to do this, and so it's bold. I don't think there's anything in the history where we have had such a massive challenge to get vaccines into the arms of people. But it is necessary. We have to get to a place where we break the spread and we outrun the spread of variants. So to make these vaccines really help us get out of this pandemic, we have to do it. Now, President Biden and Vice President Harris have committed an awful amount of resources to help make this real. The investment in providing resources for rural clinics, for example, will bring the vaccines closer to populations that have really been, not in the mainstream of the vaccine distribution so far. We've got to work on hesitancy, and that's going to mean improving education, and it's going to mean really bringing the message down, and the messenger has to communicate effectively in those pockets where there is hesitancy and resistance. Misinformation has to be addressed, and so the investment in vaccine education that the Biden-Harris administration are doing is going to be well spent. But it's a big, heavy push. I see this as the last 5-mile push for our really getting on top of the vaccine domestically. Globally, we've got to deal with making sure that more than 10% of the countries, have access to vaccines. The threat anywhere in the globe is a threat to all of us. And so we've got to double down our efforts and get vaccines out into low and middle income countries where the need's great. And that would include, getting India more access to vaccines.
A lot of work to be done yet. Dr. Michelle Williams, Dean of Harvard School of Public Health, really thanks very much for being with us today.
Pleasure.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.